Question 31. A Muslim resident wants to fast all day during the month of Ramadan. What should the facility do? A. Make the family provide appropriate food for the month. B. Refuse to allow fasting for obvious health reasons. C. Ask the dietitian to meet with them to plan for the month. D. Request that their doctor to explain why they need to eat regularly. Answer C. Explanation. Cultural diversity includes diets for religious reasons. There may not be foods that are not allowed, strict rules for preparation, or fasting on certain days. Diets may be important in the healing process for these residents. For Muslims, Ramadan is a basic part of religious practice. During the 9th month of the Muslim year, strict fasting is observed from sunrise to sunset. Not getting what they need can feel like a sin or violation of their faith. Healthcare professionals must make sure their residents' dietary needs are met and their religious beliefs are supported. Question 32. All the following are in the Resident Bill of Rights except A. The right to be free from sexual, verbal, physical, or mental abuse. B. The right to use another resident's possessions. C. The right to choose which activities to participate in. D. The right to be free of corporal punishment and involuntary seclusion. Answer B. Explanation. While every resident has rights that apply to their care and privacy, they do not have the right to complete freedom in regards to their surroundings and other residents. Their rights are personal and physical, pertaining only to their own care. Question 33. Which of the following is a right of residents in a nursing facility? A. To take all the drugs they want. B. Making as much noise as they want. C. Refusing treatment ordered by the doctor. D. Smoking in their room. Answer C. Explanation. Where every resident has rights that apply to their care and privacy, they do not have the right to complete freedom in regard to their surroundings and others' residents. Their rights are personal and physical, pertaining only to their own care. Question 34. Restraints are used for all of the following except A. To prevent the patient from pulling out tubes or lines. B. To protect the person from harming themselves or others. C. To allow staff to take care of other patients. D. To prevent falls from a bed or wheelchair. Answer C. Explanation. Restraints can be useful for prevention reasons, such as keeping a patient from falling from a bed or wheelchair, and to keep lines and tubes intact. Many surgical and intensive care units use restraints in this manner. Restraints may also be used for behavior issues, such as possible physical harm to themselves or others. Question 35. If a resident refuses a bed bath, which is the best response? A. Whatever. It gives me more time to help someone else. B. Sorry, but our policy is that everyone gets a daily bath. C. I really think you need to be cleaned up. You smell. D. Why don't you think about it? I'll check back with you later. Answer D. Explanation. Every resident has the right to make decisions regarding their care, including refusing care or treatment. The nurse aide can explain the benefits of a bed bath and give the resident time to reconsider. Do not proceed to bath them. A resident could file a grievance after being bathed against his will, and the nurse aide could be disciplined. Question 36. A resident refuses lunch, but about 2 hours later decides she would like a snack. What is the nurse aide's best response? A. Do you think you can wait a few more hours? Dinner will be ready then. B. Residents are not allowed to eat between meals. Besides, you had your chance. C. Sure, let me just check your diet and then I'll bring something to you. D. The kitchen is clean up now and doesn't have time to make anything. Answer C. Explanation. According to Medicare, residents have the right to make decisions regarding their schedule, including when to eat meals. Remember that for residents, the facility is their home now. They are able to choose their own schedule and activities. The nurse aide should check the diet orders, then bring a snack to the resident. Question 37. A nurse aide refuses to discuss a resident's condition with a neighbor. Which one is the resident's rights is being protected? A. Privacy. B. Respect. C. Confidentiality. D. Informed consent. Answer C. Explanation. It can be tempting to share medical information with others who know the patient, but even general information or conversations about behavior are violations of the HIPAA privacy rule. Be honest and firm about your responsibility as a healthcare professional. Question 38. Of the human needs listed below, which are considered basic? A. Social. B. Spiritual. C. Sexual. D. All of the above. Answer D. Explanation. Every person has needs which must be met in order to achieve their goals and feel satisfied. Beyond the basic physical and physical needs, food, water, shelter, safety, people also need to connect with others. Spiritual needs include feeling connected to a higher power or nature. Sexual needs are finding intimacy with another person. Social needs include friends and community. These needs may shift in importance throughout life, but they're always present. Question 39. It is appropriate for a nurse aide to share the information regarding a client's status with A. Anyone who knows the client. B. The client's family members. C. The staff on the next shift. D. The client's roommate. Answer C. Explanation. It can be tempting to share medical information with others who know the client, but even general information or conversations about behavior are violations of the HIPAA privacy rule. Be honest and firm about your responsibility as a healthcare professional. There are strict penalties for sharing information with others, even the family, if the client does not want them to know. Question 4C. When a resident is expressing anger, the nurse aide should A. Ask the resident to speak in a kinder tone. B. Listen closely to the resident's concerns. C. Remind the resident that everyone gets angry. D. Correct the resident's misperceptions. Answer B. Explanation. Allow the resident to express their feelings and emotions. Use empathy to put yourself in their place. When a nurse aide uses active listening to communicate with the resident feels respected and appreciated. By giving the resident undivided attention without interrupting, the aide-resident relationship can develop. Listening also helps avoid misunderstandings. Thank you for watching.